Getting all of these. Nothing good. Yeah. Don't worry about it. No, it's all over. Hey, Mike. Well, I mean, you've probably seen with all the conservative groups are changing over the smallest things about this. It's national government committee. Marissa, are you still doing the flag raising tomorrow?
We are, only the flag raising, no like
Okay.
dancers or anything.
Is it, what time is that?
8 a.m. I believe.
8 a.m. or?
Can't like not just put the flag up, right?
I'll be here. It'll be nice covering something that's not coronavirus. Tomorrow. It's tomorrow, yeah. Doesn't feel like it. Certainly not going to feel like it in you.
Welcome. This service is provided by freeconferencecall.com. Please enter your access code followed by the pound or hash sign. If you are the host, press star now. Otherwise, please wait and you will be joined into the conference. Please announce yourself.
Hello, this is Marissa with the governor's office. We're going to give everyone a few more minutes to hop on, but we'll get started here shortly. All right, I don't know if anyone says anything, I'll be back.
go on like that.
You can just start when you're ready.
All right. And you got Quinn on the line.
Yeah.
And just, I'm sorry, Todd, the agency, what's your role again?
I'm Administrator of Public Health and Safety.
You think,
No.
how many
Sorry.
times can, you just talk, you just.
Hey, Steve Bullock here. Good afternoon. Thanks for joining the call. Also with me is Dr. Greg Holzman, State Medical Officer, Todd Harwell, Public Health and Safety Division Administrator, and General Quinn's on the phone. We made some announcements yesterday, so I wanted to afford the opportunity for questions to be asked. My top priority is to protect health and safety Montanans, particularly our most vulnerable, at a time when we face the potential for really extraordinary health risks from coronavirus in our state. With 6 confirmed presumptive positive cases in our state at this time, I made the decision yesterday to issue several directives and recommendations to our fellow Montanans so that together we can lessen the impact of COVID-19 in our state by reducing the speed at which it spreads. Our first priority is certainly prevention, though through social distancing and getting information out to the public about how to prevent the further spread of COVID-19. The goal right now is to keep as many people healthy as possible, and these are difficult decisions by all means. But by taking the difficult steps now in the short run, we can stop the disease more quickly, we can reduce the strain on our frontline healthcare providers, and prevent even more long-term challenges. Public health authorities have strongly recommended taking these steps now. I directed public K-12 schools to close starting today until March 27th. All across our state. I want to be clear that this decision was not made lightly, and it's one that I really know that it will disrupt Montanans, their families, and school districts over the coming weeks. Also want to be clear that the directive to close the schools for 2 weeks to allow for schools to plan for all the other matters and services that students need, such as school meals. So they're doing that planning right now, so to take the immediate steps our kids need, as well as in the event of future or ongoing closures. Our schools really do serve as a lifeline to so many families across our state, and we'll continue to work together to address the challenges of students, families, and communities to try to mitigate some of these impacts. And we see schools and communities are already stepping up to adapt to these changes, find ways for students to continue to receive an education and resources during this time. I'd urge everyone to have some patience with districts and communities while they plan and adapt. During this, the 2-week closure, and I've also directed the schools continue to receive their funding as appropriated by the legislature. We haven't yet made a decision about whether schools would need to make up instructional time, and that decision will depend in part on how effective our early measures are at reducing the impact of new COVID-19 infections in Montana. As soon as we know more, we will certainly let the public know. Employers also should be taking seriously and should seriously consider telework for impacted families, make plans in case that becomes necessary, certainly to mitigate the impact of school closures on families, encourage all employers to be as generous with their employee paid and sick leave policies during this time. Businesses, too, have already stepped up to be role models in their communities by making difficult decisions to close or limit events, and I thank them for this as well. The directive that I put out yesterday, I've also suspended visitation in Montana's nursing homes except for certain compassionate care situations. Nursing homes are a particularly vulnerable population, as we can see from Washington State and indeed all over. We have to recognize that Montana also has a higher rate or a higher percentage of legacy Montanans or older adults, those that are most susceptible to COVID-19, and that this measure of suspending visitations is imperative to keeping these legacy Montanans safe. People who do meet the exceptions for visitation will undergo a screening to determine whether they've traveled in the past 2 weeks, whether they've had recent contact with someone with a respiratory illness, are residing where community spread's occurring, or if they have symptoms consistent with a respiratory infection such as fever, cough, shortness of breath, or sore throat. Finally, and critically, something that we must all do is practice social distancing. Social distancing is one of the primary protective measures we can all use to flatten the curve of new infection. Strongly recommend that the public limit all gatherings, especially those more than 50 people, in every community across our state. Let me say that again. I'm strongly recommending against planning, holding, or attending all gatherings, large gatherings. Those of 50 or more people present greater risk, though. And it doesn't have to be a meeting or a conference. It can look at anywhere where large groups of folks gather. I understand, and I also recognize, again, the hardship that this creates, particularly for young and healthy Montanans that want to get out as well, but it's absolutely essential to protecting our friends and neighbors who are most vulnerable to spreading this disease. Those vulnerable individuals also should take even greater precautions. Individuals over the age of 60 and those who are immunocompromised or have chronic health conditions should take extra precautions to avoid gatherings of greater than 20 people. Parents should avoid, if possible, placing children for child care with grandparents or individuals over the age of 60. I can't underscore the seriousness of following these measures to help our neighbors, friends, and families, and because their safety really is in all of our hands. We Montanans, we've always rallied together in times of crisis. There's no doubt that family schedules will be uprooted. Sacrifices are going to have to be made. But I think the time to act is really now before the spread of infection gets worse. Yes, we're going to cancel events. We're limiting gatherings and instead spending time with healthy family and friends. This is serious, and the actions that we're going to take now will certainly ensure our state's better off in the long run. So I thank all those who continue to make the difficult but correct decisions each day, and all those who are practicing and advocating for social distancing. It's going to take all of us working together to overcome these challenges, these challenging, and it is, as I've said time and time again, dynamic times. But as Montanans, I have no doubt that this is what we do. So with that, I'd open up for questions.
Governor, looking at newspapers. Hey, just wanted to check and see. You talked about strongly recommending limitations for gathering of more than 50, but we still have bars, restaurants open where people are gathering in numbers greater than that. Would you consider taking that beyond just a recommendation and making that a requirement?
Yeah. Thanks for the question, Holly. You know, I've actually been speaking to some, both representatives of restaurants and others, and I think that you'll see some shutdowns even tomorrow to take out only, but in those conversations, and I think local health departments are in those conversations as well.
Olivia, I was attending to Montana. Silver County just announced that locally they are closing all bars, restaurants, casinos, breweries, and gyms. What's your reaction to that? And is that a similar plan that you would consider implementing statewide?
Yeah, I think the local health department, and especially with St. Patrick's Day around the corner, just made that determination. And it is, look, I am strongly discouraging any social gathering of 50 or more people. So while I have not put that mandate out, and I know that a lot of local health departments in our larger communities are, we have to practice the social distancing to keep people safe and to do everything we can to mitigate the further spread of COVID-19.
So just to be
Governor,
clear,
just to clarify, you're not ordering the closure of bars and restaurants statewide, but you're leaving it to local governments to make that decision. And is that concerning that might result in a patchwork of different regulations that would create an inconsistency across the state?
I am not as of today. It's a very dynamic situation. We made the decision just yesterday to close schools, nursing homes, put out these social distancing guidelines.
Governor Bullock, Josh Margolis, new media broadcasters in Havre. Where are you guys at with testing capacity now, and when do you expect to receive more tests from the CDC?
So right now, as far as the raw numbers, we could test another 750 individuals, expect another 1,000 tests arriving from the CDC on Wednesday. We do though, and I do have concerns about ensuring that we will have enough in the near future. And it's not just the tests, right? It's the adjacent supplies. It's everything from the swabs and the vials that are transported with the swabs. I was just on a call this morning with other governors who expressed concerns about both the numbers of tests and supplies available. And we'll continue to push the federal government to provide what's needed. I think that doctors, because it is the physician and the primary, the frontline care providers that are making the decision to test someone, and if they're symptomatic, and I think it's one of them that they're all cognizant of what's happening not only in Montana and around the country as well. We know that the more people that are tested along the way, the better indication we'll have overall of sort of where COVID-19 is and the rates of infection.
Governor, this is Holly Michaels again. I'm wondering, President Trump's poll today said governors should seek out their own respirators. What kind of requests has Montana made for respirators at the state level outside of what local hospitals might be doing?
Well, right now we're
we
just
have concerns with and help
getting
governors
assessment.
to figure this out on their own for now.
Yeah, thanks for the question, Holly. I mean, right now we are getting an overall assessment of what the supplies are all across the state. And that this is something that I will count on the federal government to be a partner in. And it's not just go find it on your own, that I think I and all governors are, that we need that partnership so that we do have the supplies necessary.
Governor Bullock, it's Martin Kingston with the Missoula Currents. The City County Health Department here in Missoula expressed concern over the lack of a mass quarantine facility in the event that a virus shows up in a homeless shelter, on a tour bus, or on an incoming flight. Is that something the state is working to
That's something we are
identify somewhere in Montana?
Yeah.
Thanks for the question, Martin. I mean, we are looking at it and different potential facilities around the state.
Governor, this is Holly again. I'm wondering if there's any guidelines from your office specific to daycares, looking at that cap gatherings that you'd like people to follow, but also on the flip side, recognizing daycares might be overwhelmed with school closures, and if your office is looking at loosening any regulations, maybe around providers required per child or something like that.
We are having those discussions, Holly. as far as both the loosening of potential requirements and daycare availability in the directive yesterday, didn't close daycares. It was a significant first step to close our K-12 public schools. And as I've stressed every one of our calls and meetings, that it's a dynamic situation. We're committed to doing everything we can to try to bend this curve and flatten the curve.
So what are the chances that the school closure will extend beyond 2 weeks? And also, how long are we talking for a lot of these precautions before we actually see a change in something where we can say, okay, we're being effective? Is this going to go on for like months, weeks? Do we know?
We don't know. I mean, we don't know.
And how are we going to know? What sort of factors are we going to look at and say, okay, maybe we can back off on some of this stuff?
Right, so I think a lot of this is going to be coming from the national level as we look at what's not only happening around the country, but also what's happening around the world. And as we start to look at how individual hospitals are being hit, who is being most affected, what are the best strategies that we can do to keep people safe, I think these guidelines will be continually updated. If you notice, everything from the CDC on all their guidelines are interim guidelines, meaning they're updating them as we go along. And as we watch the curve, we watch who's getting affected, we're watching what's happening in the communities, we'll see more coming forward as far as guidance, which might mean other things put into place, and it might also mean some things being pulled back.
Yeah, but let me be clear too that part of the rate of infection or positive identification in Montana is in our hands. So, I mean, we closed the schools for 2 weeks. I could not give an assurance that we will open them in 2 weeks, but I also know the more that we do as Montanans to try to flatten the curve in Montana, the more likely then that we could take actions to reopen things.
What's your biggest concern right now?
Hold on just a sec, Holly, there was a question here. What's my biggest concern in Montana? I mean, yeah, it is again a fairly dynamic situation, and responding in the protective ways that we need to. Again, the most vulnerable populations are elderly, are medically frail, and we have to do everything we can to protect them and to ensure that everybody from our local public health departments to our frontline workers to our first responders have everything to the extent that we can help provide. There are a lot of balls in the air, and I know that the impacts to families are significant, even by what the determination we made yesterday. So we're doing everything we can to recognize both the challenges out there and the best way to mitigate the further spread of this and protect people.
Governor Bullock, this is Peter from Missoula. Hey, I'm speaking as a genuine legacy Montanan. Has there been any thought about the actual economic impact of all these moves long term for Montana, or is that not a concern right now?
Peter, I think as far as somebody, I think over the weekend asked, had we calculated that? I mean, I think the economic impact is significant to Montanans and people across, indeed, our entire nation. And it is a challenging time in that respect. But I think that we have to do everything we can to flatten the curve on this, to try to make sure that this virus is contained as well as we can. And what's been heartening to me, too, is that this isn't something just from the top down. I mean, I've had bar owners and restaurant owners calling me and saying, here are the steps that we are taking. I've had, had a great conversation with the superintendent of public instruction yesterday before I had made the determination when I said, here's the step that I'm taking. I've heard from local school officials, local community officials. So once again, as Montanans, we recognize that in challenging times, we have to come together. And we have to recognize that we are impacted, but we have to take the best steps that we can, given the information that we have, and also recognizing that that information can change literally each and every day.
This is Holly again, and this might be a question for Dr. Volkman. I'm wondering if you can walk me through some of the challenges in looking at bed capacity and supply capacity in the state's hospitals and what the state is doing to track that as best it can.
Todd or either one.
This is Dr. Holtzman. Through hospital preparedness grants that we have had through preparedness for a long time, we keep in contact with with the different hospitals who report in bed availability that they have, ventilators, and that aspect. And we encourage, although we know that they are extremely busy at the hospital level, to make sure that they're keeping that data up to date, and they've been doing a great job, and we are monitoring that quickly.
This is Catherine Houghton with the Chronicle. Is that data going to be publicly available?
Yeah, as far as number of ventilators and things, probably not.
That can be discussed, but the biggest issue is it's very hard to put that up because it can change minute to minute. So a ventilator is being used, that's offline, then it's not being used, it's back. We would always be running in circles to try to keep that number exactly accurate.
And this is Todd Harwell from Public Health too. The other challenge is we want to have hospital staff focusing on caring for patients and not minute by minute entering numbers about beds.
So Governor, the children graduating school.
Hold on just one sec, Phil. Dennison's asking the question.
How are these kids going to learn? We had a discussion about how they're actually going to be taught.
Sure, there are a number of different things happening. It depends. It's community by community basis. That's one of the reasons why, we're asking our educators, and we'll be working with them to provide remote learning where they can, as an example. Like, I know the Helena District has said, I think by Thursday of this week, they're going to be providing remote learning. And that's all the way K through 12. But it also takes some ramp up time. And other districts, it might take a little bit longer than that as well. Phil, go ahead. No, sorry, Catherine. I stepped on Phil Drake, so we'll let Phil go, and then you can ask.
No worries. Go for it.
Mr. Governor, I got a couple calls today from people who say their employers are not helping them out or offering anything, that they're losing hours or work. What should I tell them? What advice would you give these people? Is there any kind of aid out there for them?
Is there any kind of what? Aid out there? So there's discussion right now at the federal level of some paid family leave issues, and we just encourage employers to try to work with people.
Okay, so there's no place they can go or anything like that. They're just sort of on Are you talking folks that just want to take leave, or folks that are laid off? The folks who are laid off because of
Oh, well, get a hold of our unemployment insurance division immediately.
All right. Thank you, sir.
Governor Bullock, this is Adjutant with NBC Montana again. Just to follow up on those 6 cases, do you guys have any idea how long it will take for the CDC to make that official confirmation?
So they're not even going to make. So at this point, They're confirmed. I mean, the CDC is no longer going to be looking at them and doing a secondary test. And Catherine, I stepped on you from Bozeman.
No worries. Thanks for circling back with me. I'm wondering if there's any sort of update on private labs coming on board to provide COVID-19 testing.
Okay, sure. This is Todd Harwell. So as of this week, or as of last week, there were 4 private labs that were, I believe, up and running and providing testing. They're all out of state, but they provide laboratory services for hospitals and outpatient clinics across the state. And these are large volume labs. So yes.
They're shipped out of state.
Correct.
Yeah. Yep.
And can you say, it's hard for me to hear some of what you're saying. You said all those labs were out of state?
Yeah, that's correct. They provide service.
And what does having those labs on board mean for Montana's capacity to test more? Or does it add to Montana's capacity?
It totally increases our capacity to provide testing services for healthcare professionals.
In some hospitals, just regular. So some hospitals haven't been even sending to the state lab throughout. They just go through their private lab provider. Yep. But the accessibility, and we're continuing to also do the assessments of where, to the extent that additional capacity is necessary, where we're going to be able to find that capacity. Go ahead, Dr. Holzman.
Just for clarity's sake, so tests are done by being swabbed by your healthcare provider. That lab, once they do it, is sent to either us at the state lab or could be sent to one of these private laboratories that are out of state. Providers, as they're trying to figure out who is the most important to test at this time, they are also trying to decide where to send that. We at the state lab are a lot faster in being able to turn that answer around. So with cases that they need to know the answer right away, they're going to try and get that to us. For cases where they probably think of lower risk, they might send it to an outside facility. Either way, that patient, the second they are swabbed, are considered to be, they're going to follow them as if they're positive until we get the negative result. And they're going to be told to go home and self-isolate themselves until they get a final answer back. And of course, their symptoms are gone. So that's kind of the way that we're talking about it. And I can't reiterate enough what Governor Bullock has said over and over again is what we're doing now is what we're hoping is going to make a huge difference in the future to decrease the number of cases and decrease the number of the stress on our hospital systems and our healthcare providers so we can give the care that every person who needs it can get it.
And going back to medical supplies really quickly, I understand that providers are swamped right now, as well as you all. But I'm wondering if it's hard to give the public an answer on what medical supplies are in the state, how are they keeping the state, you all, up to date on what supplies are available?
I think supplies are a hard thing in specific to answer. There are some supplies, you know, all the hospital systems and stuff like that have their own suppliers that they've used all along when they're ordering and keeping their supplies within their areas. The challenge right now is across the country, everybody is going to their suppliers and asking for these materials. And this is something as a unified group, not only from the state but across the country, is to get that information and make sure those supplies are available. And that's where the work that Governor Bullock and others are talking with our federal partners to try to encourage and figure out the best way to get that to all of us.
Governor Bullock, this is Megan Lewis with ABC Fox Montana. Can you go through the testing numbers where we're at right now? The latest on the website says 169 are tested. Are there new numbers for that?
I can give you.
Yeah, I'll give it to Todd Harwell.
Hi. So currently, we tested 204 people so far, and we have approximately 109 people who will be, or patients who will have testing done today. So that's the latest.
209 to date. We have 104 that are being tested today.
I'm sorry, you both just said different numbers. Is it 204 people so far and 109 who, can you say them again, please?
Oh, it was Bullock's fault. I transposed the numbers.
No, there's 204 people who've been tested so far, and 109 people, patients will be tested today. And then unless there's something potentially wrong with our website, we update that every evening as soon as the final test results are done, so you can refer to that every day.
Do you expect the results of all 109 of those tests today, or will those roll out in the coming days?
They're all today.
Yeah. Once a batch is started, we expect to get those results. Sometimes there might be an indeterminate that needs to be rerun. That doesn't mean it's positive or even has a higher risk of being positive. It just needs to be rerun. So if we say 109 now and report later tonight 107 are negative, that doesn't mean the other two. We will be very clear when there's something that's positive.
This is Justin with the Flathead Beacon and Council. Do you have an update on the 6 people who have been diagnosed with the virus?
Yeah, to the best of my knowledge, I mean, they're regularly checked in by their local health department. To the best of my knowledge, they're all at home.
Right, we have time for one more question.
This is Holly one more time. I'm wondering what sort of accommodations have been made for state employees if you're looking at closing any sort of either public or non-facing public offices or state buildings or anything like that.
Well, we put out a guidance last night trying to answer some of the questions, and it's something that we continue to plan toward. And as I said, it's a very dynamic situation.
Thank you.
Great, thank you all for sure. Then maybe if we could all, I've got another issue that came up.
Okay, crazy.